Hello, I'm Liz Mearns. I'm the Medical Director for the Wessex area of NHS England, and I used to be a general practitioner in the south of England. And I want to talk today about the cervical screening test. And this used to be known as the smear test. We've stopped calling it a smear test because the technical details of the sampling have changed. So we're trying to use the expression cervical screening. And we need to encourage people over the age of 25 to have the test done on a regular basis.
I would say preventative care, really.
Awkward.
The unknown and potentially painful.
They're quick and relatively simple.
For me, thinking about a smear test is a really good and positive experience and something I'm really grateful for.
Well, we know that populations who have high uptakes of cervical screening tests have much lower incidences of advanced cervical cancer and also deaths from cervical cancer. What the test does is it picks up early changes in the cells which over a period of some years could lead to an invasive cancer. And these changes occur usually as a result of exposure to a particular virus called human papillomavirus.
I was really anxious on the lead up to my smear test, and before I was 25 I did even look into having the test sooner because I was just quite anxious and wanted to have it done. But when I went there, the nurse was really nice, it was over really quickly, and it wasn't nearly as embarrassing as I thought it was going to be.
I can't really remember. It must have been quite simple and straightforward if I can't remember.
It was quick, it was pain-free, a little bit uncomfortable afterwards, and then but the reassurance that it gave me, and also the checkups afterwards, so took me back in after 6 months and then 12 months for a basic check, and everything's been fine ever since. So I'm really grateful that I had my test. It was, they spotted something that could potentially have been a real problem, but with a little bit of treatment my life just carries on as normal.
It was fine actually, it was really easy and the nurse was really lovely, and yeah, it wasn't half as bad as I thought it would be.
To make sure that they're safe and free of anything that could be of any danger to them in terms of cancer or abnormal cells.
Because they could potentially save your life. It's free and it takes 10 minutes. Why not?
Yeah, it's really important because, you know, I mean, it can be detected early if there are any abnormal cells.
Because early detection's good. If they find out, they can do something about it. If they don't know, they can't.
In the country today, this is a great opportunity and it's a free service. Other countries don't have this service, or if they do, they have to pay for it. And we shouldn't dismiss it just because a letter arrives in the post. And it is potentially 10 minutes of inconvenience. If you've not had one before, okay, it's a little bit embarrassing, but they're usually female doctors. You can ask for female nurses and doctors. So for that 10 minutes of inconvenience, the rest of your life just carries on with, and so it's great.
So we would encourage you to put up with the few minutes embarrassment every 3 to 5 years, depending on your age, because it really will have an effect on reducing the risk of getting cancer.
Don't wait. Talk to your doctor. It's quick and easy, and you can save your life or a loved one's life.